I'm Wendy Loretto and I'm Principal Investigator in the Supporting Healthy Ageing at Work project. We start from the position that there's an urgent need to make the health of older workers more visible. So currently in the UK, 1 in 3 workers is age 50 or over, and that proportion is set to rise. 44% of people aged between 50 and 64 suffer from a long-term health condition. But despite those statistics, we really don't know very much about the health at work of over 50s. So this project is designed, first of all, to find out more by talking to groups of employees in financial services, in care and in manufacturing, and also a group of older self-employed. We will be asking them about their health needs, their problems, and in particular, we want to focus on what we're calling more hidden aspects of health, the things that don't get talked about. For example, menopause, or combining unpaid caring and work, financial well-being, or indeed a rising problem of cognitive decline or possibly early stage dementia. So we want to talk to older workers to find out about their concerns, their problems, the supports that they've had, what might have worked for them, and importantly, where the gaps are. What we want to do is, working with that information and with the over 50s themselves, is to then start to co-design interventions that could make their working life better and help support some of the health needs they have. This is the early stage of the project. We're very excited to be started. We're already working with a number of businesses and a number of startups in order to be able to think about technological ways of improving things.